Let's do some NCLEX practice questions. I've received numerous requests to teach how to answer questions. So of late, as you can see, I've been doing a lot of questions in order to give you some content, nursing concept content that you need to pass the exams, but at the same time showing you how you should approach each question. So we're going to dissect about 25 questions and using test-taking skills. So stick around and see what I have for you. First question, it's straightforward. It looks scary. Test-taking skills. Start from the back. Which of the following the nurse will do what? Will expect. So unexpected finding. Then read the content underlying the password, right? A nurse is caring for a sickle cell client patient. Okay. Admitted for sickle cell crisis. Okay, what is the issue? Client asked the nurse the risks of having a sickle cell child. It's a sickle cell child. The client fiancé is a sickle cell carrier. You see, there's a bunch of ways. You see, I underline them. So the way I will rewrite the whole thing is, I have a sickle cell patient who is now engaged to a sickle cell carrier, and he or she wanted to know whether they're going to have a sickle cell child when they have a baby. The patient, which is the client, okay, has what? Is a sickle cell client. So if you represent X as a sickle cell, so small s and 2 small s. A normal gene person will have big X and 2 big S, so 2 big S. If you're a carrier, that means you have one normal gene, big normal gene, and a circular gene. That's how they call it carrier. And so this client is going to mate with this client. So you do your Punnett square. Just draw a 4 square like that, because there's 4 genes, right? 1, 2, 3, 4. And you divide it into that. And you say, put the client here. The client as what? 2 small s. And then put the carrier, that's the spouse, 1 big S and 1 small s. And then let them cross each other. So this is the this thing that you have. You have this and that. So if they have a baby, if 4 children, 50%, 2 out of 4 is basically 50%. Half is going to be this person and half is going to be that. This person is what? A carrier, and this person is a sickler. To be a carrier. So having a sickle cell baby is 50%, which they have to think wisely about it. So that's the first question. This, I want to show you concept in case they ask you these kind of questions. It's just an application, okay? These are hard questions. Calculation, dose calculation. So let's go. What is the problem? If one, they say calculate what? Drip per minute. I put, this is what I need to have. That's my answer. Drip per minute. I put it here. They say, and then receive an order of infusion of what? And I put 1,000 ml over 6 hours. And I look at it, I say, oh, the answer choice is in what? Minutes. I need to convert this right away into minutes. So how do you convert hours into minutes? So 1 hour, we'll go here so that you can and cancel, and then 60 minutes here. So hour, cancel, and you have minutes here. Now you got to bring what the what usually comes in, how the medication comes in, right? The prescribed dose versus the available. Where is the available? I don't use formulas. I use just the dimensional analysis. What is available? The medication, right? It said if only macro, pay attention, drip IV tubing is available. I've given you the available by giving you what? Macro. The macro drip is usually the smaller one. So 20 drops per ml. What I mean is smaller one, the drops are smaller. If they're big by less drops, in an ml. And since my answer choice has to be a drop, so I'll put the 20 drops on top. So 20 drops over ml. And so this cancel this like that, right? The ml cancel. And this give you 55.5 drops per minute. Most of the time, they want you to convert into a whole number. So this would be like 56 drops per minute. So that's how you calculate this answer choice. Okay, just using dimensional analysis, you just flip the numbers the way you're supposed to. You start from your answer choice first. Okay, next question. We're working on test taking skills. We start from the back, select all that apply. I know that means more than one answer. Which of the following the next will include? That means I have to include in the teaching, okay? That's what I'm being asked to do. And then what is the case? And next is teaching you graduate about possible cause of what? Hyperkalemia. Therefore, I have I increase in potassium. Which of this is going to cause hyperkalemia? That's all. You look at it and you said what? You bring in your content. Which of these causes hyperkalemia? What is that? Bumetanide. You know that this is a form of what? Loop diuretic. What is the number one side effect? This causes hypokalemia. Test taking skills. Right away, I've taken it off. Crohn's disease. You have to recognize it. What is Crohn's disease? This is an aldosterone secreting tumor. What does the aldosterone does? What it does? It increases your sodium so that it can increases your blood pressure, right? And therefore what? It causes hypokalemia. So this is also gone. Addison disease. What is their problem? They have no aldosterone. You see, I'm just using the same thing. They have no aldosterone, negative aldosterone. If aldosterone causes hypernatremia and hypokalemia, if there is no aldosterone, your sodium go down and your potassium go up. Therefore, this is hyperkalemia. Renal failure, yes, everybody know. You cannot get up the electrolyte. The most common electrolyte kidney people have is hyperkalemia. That's why they do dialysis. Metabolic acidosis. Think about it. This is the cell. There's too much acid here, like that. I have to push the acid inside the cell, right? H plus inside the cell. I have to balance the H plus. If I move the H plus down, I have to send another H plus up. And the H plus usually is potassium. Therefore, acidosis causes hyperkalemia. Alkalosis, that's different. Alkalosis causes hypokalemia. Right? So, prolonged NG tube. If you have NG tube in your stomach, okay, what is in your stomach? You have an acid. Removing all the acid and the sodium. And then you lose your sodium. What is the kidney going to do? It said, I've lost all my acid, I've lost my sodium, I'm dehydrated. I need more sodium. The kidney said, will say, take sodium back and get rid of the potassium. So people who have NG tube have what we call hypokalemic, hyponatremic, metabolic alkalosis. So that's their problem. And therefore, this also does not cause hyperkalemia. It causes hypokalemia. So the right answers are 3, 4, and 5. And then 1, 2, and 6 causes hypokalemia. Content you have to know. It's a good question over here. I said, nursing concept. A nurse is caring for a client with the following charted in 8 hours. So in 8 hours, this is what we have. I have 2 cups of what? Ice. So you have to calculate, convert the ice, and you have to know this number. 1 cup is equal to what? 8 ounces is equal to 240 ml. If you have 1 cup of ice, it will be half because it melts into half form. So 120 ml. That's what we need to do. So somebody with the 2 cups of ice, you don't multiply it by 240, you become 120 times 2, which is 240 ml. 3 cups of orange juice. So yeah, 3 cups orange juice. So 3 times 240. 1 cup of water. So 1 cup of water is another 240. 4 cups of puree. This is always a trap. A puree is not considered as a liquid. It's not. And therefore, this is 0. Puree will get a 0. Don't add it to it. 1 cup of ice cream. Ice cream is already melted. So ice cream. So 1 cup will be just 240. So that's the intake for that. So if you add all of them, it's equivalent to 144 ml, right? And then look at it. LR at 30 ml per hour. So every 1 hour is getting what, 30 ml. Therefore, in 8 hours, you will get what? 8 times 30. This will be 240, right? ml. This is how much fluid you got. And his urine output is the same thing, 30 ml per hour. So urine output will be 8 times 30. That's 240 ml. And we're supposed to calculate net fluid gain or loss. Therefore, I know total intake is what? 1440 plus 240 of the IV fluid. And total output is 240. Therefore, this will just cancel. And you know, there's a net intake, which is what? 1440 ml. So that's the answer. Same calculations, right? And next, receive the following order for a patient in DKA. There's an order. Listen to, you have to pay attention. As I said, test taking skills. I hear an order, I know that's the prescribed dose. That's what I'm being given. For a client in DKA, 2 units per hour. So I need to give the patient 2 units every hour of insulin, regular insulin, right? Then I look at the answer choice. How should the nurse program the pump to deliver ml an hour? So I have to leave it in an hour. I should not convert it into a minute. So the answer choice is an hour. So I leave it. 2 units per hour regular insulin and titrate accordingly using sliding scale. The pharmacy supply available, right? What? 100 units into 200 ml. I know I should have ml on top, so I'll put 200 ml here. And then we have what? 100 units. And so units cancel. You have what? 400 ml over what? 100 hour. You see this 100 because the unit cancel. And therefore this cancel. And you're left with the 4 ml per hour. So the nurse is going to program the whole unit to provide 4 ml per hour. That will give the patient 2 units every hour. And this is how you do this dimensional analysis. You see a long question, test taking skills, paying attention to the buzzwords, and then using them to answer the question. Okay. Next question, number 6. This is another calculation. There's a lot of calculation. I want to show you concepts, so bear with me. The nurse is caring for 4 clients who had thoracotomy 1 hour ago, who need to be seen first. You have to be sharp. It's a priority question, but this is a lot of content. This small question has a lot of content, some key nursing facts you have to know. Any patient who has thoracotomy, that means they have chest surgery and they have chest tubes. There's some certain things you have to know. Okay, if the chest tube is greater than 5 to 10 ml per kilo in an hour, you got to see them. They're bleeding. Or if it's greater than 3 ml per kilo per hour, times 3 times. That means 3 consecutively. It happened the same, more than 3 ml per kilo every hour. For 3 times, you have to see them. So you got to choose which one. Sometimes you got to pick one. So I like this one better because they only give me one option. And so that's what I'm going to do to answer the question. Take first client. Client weigh what? 85 kilos with a chest tube output of 400 in an hour. Don't forget an hour. 400. So client A has what? 400 ml of this thing over 85, right? Client B, that is the same thing. I'm setting all of them. Also have 400 ml over 100. Client C, 200 ml per kilo in 38 kilos, right? And D has 150 ml over 70. So you have to calculate all of them and compare which one satisfy one of the conditions above. And so the answer for this one, 400 by this is 4.7. 4.7 ml per kilo in an hour. This one, 4 ml per kilo per hour. This one is 5.2 per kilo per hour. And the last one is 2.1 per kilo per hour. So which one in an hour is greater? So you want at least 5 ml to 10 ml per kilo per hour. Which one meet this criteria? This does not. This does not. This one, 5.2. This does not. So C is bleeding, even though he has 200 and this two has 400. So don't look at the number, look at the weight, base pair weight. So 2 is small, his weight is small, and put it at 200. That's why he's bleeding. So I want to see this one first rather than see the rest. And this is how you do this question. I like this one better than this, but because they usually will give you probably a time but pay attention, or if they give you 3 hours, yeah, you have to use it. But this is how you do chest tube bleeding, or which chest tube output should be a concern to you. Okay, if you need more, stop it, rewriting, or just leave a comment and I'll answer it. I will explain it to you if you need more explanation, if you have a question on it. I like you to send me a comment about it and let me explain it to you if you need more help. Next question. Which of the following the nurse will anticipate, anticipate to be prescribed by the physician? A bunch of words, break it down. Okay, buzzwords is your key. A nurse is caring for what? Bipolar client. That's one of my buzzwords. Who was medicated with what? Allopuridol. You have to recognize it due to agitation. It's not a problem. 2 hours later, what is the problem? Report feeling of what? Restlessness and the need to move around constantly. Buzzword. The nurse observe lips sparking. Buzzword. And frequent blinking of the eye. Buzzword. Which of the following you think is going on? Patient is agitated. We give them what? The patient allopuridol, antipsychotic. If I give you antipsych, all of a sudden, you can't stay still. and then you blinking your eye. Okay, you have lip smacking. I know you've developed extrapyramidal side effect. Cannot stay still is akathisia. Okay. Blinking of the eye and smacking, this is TD, tardive dyskinesia. These are all part of the extrapyramidal side effect. You have to know it for the psych. I'll do another questions on psych, but you have to understand them. This is the side effect. Therefore, what do you want to do? What is the treatment of this? What is the treatment? Remember, antipsychotic problem is what? They have dopamine issue and then acetylcholine. There's imbalance. When you give them antipsychotic, it takes care of the dopamine and you have high level of acetylcholine, and that is what is giving you the problem. So extrapyramidal side effect is due to overwhelming of acetylcholine. And therefore, if we have too much acetylcholine, what will you do? It take care of it. So paroxetine is what? SSRI. We're not using it. Albuterol is for asthma. Propranolol, that one, I know you'll be trapped to say, oh, restlessness. Let's use that. What is the side effect of albuterol? It will make you tachycardic and be restless. Okay, so all of this does not do that. What is going to help you is benztropine. This is cogentin. That's what we use in all practicing people. The same medication we use for Parkinson, benztropine, to help with the extrapyramidal side effect as we treat their condition. So benztropine, don't forget this medication. It's what we use when you give somebody antipsychotic and they develop an extrapyramidal side effect. Farm for you right there. Which plan of care need immediate intervention? That means something is wrong and you need to intervene by the charge nurse. You got to be sharp. A nurse is caring for a client on the orthopedic floor after knee replacement. Keyword is knee replacement. That's all. I have a patient who has a knee replacement. I'm rewriting it to my knowledge so that I can take in charge. What do I do? You see, I've changed the question. I have a patient who has a knee replacement. What do I do? How do I take care of him? I've changed the question the way I think I can have control over. What is your management for somebody with a knee replacement? Of course, we usually use knee immobilizers to stabilize the knee as they get better during walking. You want to keep the knee in extended position, right? Because of that, you should not put pillow behind the knee. So this is wrong. You can put pillow on the lower portion of the leg, but not behind the knee. And then you have to give them DVT prophylaxis. So they need immobilizer to work. No pillow behind the knee. It's only at the lower portion, and they keep the knee in extended position, prevent a blood clot. That's what you do. So which of the following need immediate intervention is that one? Even though I checked this, I mean, these are right, this is wrong. So the wrong answer need immediate intervention. Sometimes I like to do like that because it helped me. If it get you confused, just change it. Put the those that does not need as cross them out, and those that need it as a check. But when I do check, usually help me that those are correct answers, but it's not answering the question. You have to know which one you're selecting. It's not, these are not, even though I check them, they are not the right answer. They're just telling me it's true, but this is not true. So this is the answer that I need to intervene. What is the next best action? A nurse is caring for a client on cardiac unit after coronary angiography with stent placement via what? Left femoral artery. So this is the cardiac catheterization question. You know what they're going to ask. Client report pain of the leg with dorsiflexion of the left foot. So if this is the groin, we went to the groin and did the procedure, and then this leg, when this is the left side, when the client did dorsiflexion, there is pain in the leg. passive dorsiflexion. You're not pushing it. They themselves doing dorsiflexion, and they have pain. This is classic. The word passive dorsiflexion is a buzzword for signs of compartment syndrome, LE. So you should do something about it. Do you elevate the leg? No. Do you check for duplex for DVT? No. Do you call the doctor? Yes. But for stronger pain medication? No. I'll check for pulse and see if he has pulse or if you have neuro. If both of them, dorsiflexion and lack of pulse or neuro changes, yeah, even if there's a diminished force, I'm calling the doctor. So this is the right answer. Compartment syndrome. The client monitor showed the rhythm below. Name the condition. So what is the condition? What do you think? You have this. The way to read the EKG, first see if it's a sinus. The way to get sinus, look for the RR interval. And I can see by looking at it, it's uniform. The RR is uniform, therefore it's a sinus rhythm. Then I look for if there's EVP, right? Or you can calculate the rate. This is very slow. So 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, divided by 300, it's a little bit lower, like close to 60, right? So that's 300 divided by 1, 2, 3, 4, 5, by 5. So this is 60, basically. It's a little bit low. That's a heart rate I've calculated. Then I look for the P. There's every P, right? P, QRS, P, QR. Then look at the PR interval. Look at from here. This is expanding a whole big 2 bars. So 10 small little bars. Usually you want between 3 to 5 boxes. Okay. This is 10 boxes. From here to here, 10 boxes. From here, 10 boxes. Here, 10 boxes. Here, 10 boxes. I don't see any drop. So test taking scales, complete out block. There's no relationship between the atrium and the ventricle. There's a relationship. There's atrium and ventricle, atrium and ventricle. Complete out block. The ventricle is doing its thing. The atrium is doing its thing. So this cannot be that answer. So it's gone, right? I know the PR interval is longer than what I expect. Therefore, it cannot be normal sinus. I know it's bradycardia, but the PR interval is longer. Therefore, this cannot be. You see what is left? First degree heart block. Test taking skills. And you'll be able to pick an answer easily. And what I did was, I know what I'm looking for, and I did my content, spent a few seconds, did the content, and I analyzed my content with the answer choice. And you see the answer choice will pop up like a candy. Once again, leave a comment and then let me know what you think. If you need more explanation, I will do that. Another test taking skills, I will show you. Which description by the nurse is accurate? A nurse is caring for a client with EKG strip below. So which description? You got to describe this. I have not told you to name it, but describe it. Look at the answer choices. Without even looking at it, I see 1 irregular and 3 regular. That means either this is wrong or all of this is wrong, right? So I know either I can eliminate this right away or 2, 3, 4 is gone because they are regular. But I'm keeping them and I'll show you why. Look at it. Is this irregular? I see that this is all uniform. I mean, from distance between each QRS complex is uniform. So right away, this is gone. It's no irregular rhythm. Then, so I know this and this is right. Then we go to the next level. Look, they say 1P, 1P. These two has 1P and 1P. Look at if there's a P. There's no P here. I don't see P. Therefore, this is gone and this is gone. And your answer is that. You left with this. But continue. You say, oh, heart rate. Look at the heart rate. It cannot be 60 because this is fast. Really, really fast. It's between just 1 box. So it's greater than 110. You can't, if there's no P, you can't calculate PR interval. And QRS is wide. So is that. Test taking skills. If you don't know, just step back, look at it, break it down and say, I think this does not make sense. And you'll be able to eliminate certain answers without even not knowing what is going on. But I know you know, so you should be able to figure it out. What do we have here? The next note that the client is experiencing, so you have to make a diagnosis. What is the problem? And next is caring for a client post-thyroidectomy. Keywords, underline, after surgery of the thyroid. During 4-hour assessment, the nurse reported what? Temperature 102, tachycardic, diaphoretic. You say yourself, content, rewrite your content. Thyroid surgery, 4 hours, I'm checking them. Everything is up. Everything is up. What is the problem? It's not neuroleptic malignant syndrome because I have not given the patient antipsychotic. It's not serotonin syndrome because I have not given them SSRI. It's not malignant hyperkalemia because usually this happens in the PACU, and then they will have locked jaw, or it will occur in operating room. This is 12 hours later. And what am I left with? Styrostorm, because you stimulate the thyroid too much. Test taking strategy. Number 14, no, 13. Select all that apply. I know there's multiple answers there. And next is caring for a client who is 24 hours post-appendectomy, 1 day after surgery. Which of the following indicate appropriate delegation? That means giving something to your UAP. Test taking strategy. I know UAP, no thinking activity. Anything that does not require thinking, they can do it. And they can report what they see, no assessment. They report what they see. Therefore, I go, record INO. They can record it. If it's 20, they can record it, right? Report any choking episode with diet. If the client is eating and is choking, he should be able to report it. It does not require assessment to see somebody choking. There will be gaps in for it. Sometimes they will show you sign. I can't breathe. I'm choking. Yeah, they should be able to report it. Reinforce, no. That's teaching. You cannot do that. Replace. If I remove your SCD and I help you walk and I come back, I should be able to put it back on since I can touch it. Review. They cannot do that. That requires a lot of thinking, assessment. So 1, 2, and 4 is what they can do. Appropriate. Look at this question carefully. It looks small, benign, but it's loaded with content. What is the next best action? And next is caring for a client on heparin drip for DVT. On day 5, there's a reason why I give it day 5. The lab work shows platelet 40,000 and PTT 70. Breaking down. DVT, right? That's the case, right? DVT on heparin drip. And I have a PTT of 70. And I have platelet of 40,000. This is way below, right? Usually you need like 400,000. It's way below, right? And it happened 5 days later. So I have you on heparin, your therapeutic, your PTT is 70. Usually I'm happy. But what is your platelet? It's going down. This is what we call HET, thrombocytopenia. Heparin-induced thrombocytopenia. And therefore, I should stop all heparin. I should not add warfarin at all. It's loaded because what it means is assuming that everything is okay. Everything is not okay. When you had what? Warfarin, you still keep them on heparin until the warfarin become therapeutic. You know, INR is like probably like 1.5 or 2 before you can stop the heparin. This patient heparin is going down 40,000. If you continue to add warfarin and leave everything status quo, they have developed HIT. It's not good. They will develop DVT, stroke, and die. So this is wrong. Change heparin to enoxaparin. Enoxaparin is a form of heparin, so you can use it. Give 1 gram of prothrombin. You should not reverse the heparin. They are not having heparin toxicity. This is an autoimmune disease. So you give prothrombin if the PTT is probably like 200 and you expect them to be bleeding, yeah, you can reverse it. We don't need to reverse heparin. You have to change it to another form of factor 10 inhibitor, the gatrobans. They have no heparin and they can help with the patient anticoagulation. And this is heparin-induced thrombocytopenia. Stop all heparin and then put them on factor 10 inhibitors. Number 15. Which of the following the nurse should expect on full assessment? A nurse is caring for a client with what? Severe COPD. Client CVP read 16. Listen, look at this patient carefully. I have a COPD patient, severe. All of a sudden, CVP is 16. The normal CVP is 2 to 8. If your CVP is 16, you've developed right heart-sided failure, right heart failure. How do you develop lung problem? And now you have right heart-sided failure. This is what we call pulmonale. Pulmonale is a problem. When you have severe lung problem and you develop right-sided heart failure, that's what we call it, pulmonale. Therefore, what would the nurse expect? Signs of right heart failure, enlarged spleen, right? The liver is not going to be normal. The leg will have edema. Urine output is not going to be affected. This is left-sided heart failure. And the pink fluid sputum is left-sided heart failure. So the only thing you will see is enlarged spleen and left leg edema, basically. The spleen is supposed to get bigger. It does not affect urine output because that's a left-sided, and the pink fluid sputum is also a left-sided. So 1 and 3 are what she expects. Select or apply. Number 16. A nurse is caring for a client who is post-Roux-en-Y gastric bypass 24 hours ago. Which plan of care is a priority? So which one is a priority to prevent immediate complication? Stop the video, try to answer it, and then I'll answer it and compare it to you. What do you think? I have gastric bypass, which this plan of care is a priority to prevent the keyword immediate complication. I don't want to, so morbidly obese patient, okay, heart surgery. What do you think you need to do? Anybody who have surgery, I want to prevent immediate complication is wound infection, lung problem, and DVT. Therefore, ambulate. Incentive spirometer, lung problem, urine output. Yeah, I'm worried about it, but that's not a major problem for post-op immediate complication. Monitor wound, yes. Discharge planning, lay down. So 1, 2, and 4. It's a big problem. Select or apply. And this is caring for a client with what? Keywords. Pay attention. I intentionally said this. What did I put? Cutaneous diphtheria. Which of the following the nurse should include in the plan of care? We all know that diphtheria is what? Droplet. Right? But this is where test taking skills come in. You saw the diphtheria, you say, oh, okay, it's droplet. What is the question asking you? Cutaneous. It's skin problem. So is the skin diphtheria? It's no more droplet. It's what? Contact. And then you institute all the contact precaution needed. Therefore, droplet is wrong. Gown gloves for the nurse is used for contact. Standard precaution after antibiotic therapy? No. You start standard precaution after antibiotic therapy, plus you've done another culture and it shows no diphtheria, you have to do another test. After they start the antibiotic, you got to do, and they're finished, you do another test and make sure there's no signs of infection anymore before you can institute standard precaution. Otherwise, you continue with the contact precaution. So this one is partially right. Yes, you standard precaution after antibiotic therapy, but you got to say, and after culture is negative. So there's two things you have to satisfy. Use disposable equipment. Yes. 95% N95 max. No, you don't use that. And that is one is used for airborne. Okay. So 2 and 4 are your right answer. Number 18. A nurse is caring for a client with what? Type 1 diabetes admitted for diverticulitis. The client received what? 5 units of Glulisine at 8 a.m. What is the priority time to see patient again? So you have to recognize that Glulisine is what? It's one of the lag, okay? So it's one of the lag. That means the fast acting guys, okay? Fast acting, and that means the usually onset is like 15 minutes, 15 to 30 minutes. They already started, and their peak. That's when you see them. When they say priority time to see them, is this every time you give somebody insulin, you want to go see them. The time they're going to be what? Hypoglycemic, because you give them insulin, it's going to drop their glucose. So you want to go and see them back at the time they are at risk of hypoglycemia. And what is the time? Is their peak. Okay, so the peak for this is always an hour. That's the lag, the fast acting. So if I give it to you 8, I'm coming back 9 to check on you as soon as possible. So that's the right answer. The nurse is caring for a client who involved in motor vehicle collision. Assessment show inability to shrug the shoulder. The client has a palsy of what? This is straightforward. Inability to shrug the shoulder is the 11 problem. Okay. 12 is for the tongue. So this is, and the vagus is gagging, and this is a trigeminal neuralgia problem. Cranial nerve 5. So this is cranial at 11, and this is this spinal accessory shrugging your shoulder. Okay, so this is wrong, this is wrong, this is wrong. Test taking skills, look at it. Who need interdisciplinary care? Somebody who have complex problem that involve multiple services to take care of that patient. Social worker, all those things. Pharmacy, everybody to be involved. Who need it? Look at it. There's 3 IDs. There's no way these 3 IDs, one will be better than the other. Cholecystitis, diverticulitis, appendicitis. I said it this way to just let you know that they're not going to, if you know your content, there's nothing they can do. They can screw you up. How can 1 be right and 2 not be right and 3 not be right? They all hide this infection inside your abdomen. They don't need interdisciplinary unless they have other family issues. But the way I put it, you should not even worry about it. Sickle cell, this is a complex problem. This requires pain management, social worker, home situation, medication, pharmacy, a lot of treatment involved. So this guy need a bunch of people because he's going to have pain issue. The nurses will not be able to manage it. The nurse will think patient is drug seeking. Pharmacy will have to get involved. We got to have a discussion so that every nurse that come in will know what is going on so that they can stick with the regimen and doesn't say patient is hiding things or anything like that. You got to call other people, physical therapy. So this patient need interdisciplinary care to avoid complication. 21. What do we have? A nurse is caring for a client admitted for leg fracture. Yes, leg fracture, right? The client is concerned about being what? Treated differently due to the gender. Keyword. Treated differently due to the gender and race. The nurse reassured the client that it is the hospital policy to treat everyone equally. Who is this practice is known as what? So veracity is what? You are being truthful, right? The nurse is not being truthful here. Fidelity, you being loyal and keeping your commitment. No maleficence, no harm. And therefore, we got to choose this. Is it that I don't know this? I got to choose it. Injustice is like equal right for all, right? Good. Number 22. Which of the following assignment is appropriate? A Med-Surg nurse flow to the psych unit due to nurse shortage. If you go to another floor and you are not specialized there, they're not going to, they should not give you a specialized patient. They should only give you a patient that needs routine nursing care or does not need anything that is so specialized. Client with acute psychosis, Med-Surg nurse cannot take care of it. She will run away. Client with schizophrenia and catatonic features, too bad problem, will run away. Depression and ready for discharge, this is a trap. Ready for discharge. The Med-Surg nurse does not know what to tell this depressive patient, what to look for. Teaching is the most important aspect of discharge. If you are not specialized, you can't provide teaching. So the nurse cannot do anything. The only person is somebody with anxiety and psychotherapy. You're just seeing psychotherapy talking about stuff and probably need some medication and the nurse will be able to provide it. So this one is less benign. It's good for the patient. 23. The client presented to the postpartum clinic 1 week after discharge with what? Keywords. I have what? I have breast pain. I have redness around the breast. You see the keywords? Breast pain, low-grade fever, redness around the breast. Diagnosis of mastitis was made. Which stitching is appropriate? Look at it. Test taking skills. Mastitis, inflammation, right? You got to get rid of whatever is swollen, making the inflammation of the breast. So you should not stop feeding. You should breastfeed to empty the breast. The more the breast is empty, the better. And you should alternate one end as one drain, the other one get better. So alternating the breast is better. Warm compression will increase flow. We use it warm. When something is warm, it dilates the vessels and it will increase flow. So it's not for discomfort. And this is where you have to pay attention to answering questions. You see warm compression, then you say, oh yeah, I've seen something about warm compression. Look at the rest of the answer. It's for discomfort. It's not for discomfort. So it's called compression. It's not for increased flow. It's for discomfort. So it's opposite. So cold will help constrict. So it's for discomfort. And warm will increase flow. So both of them are wrong. You should not decrease your intake. You should increase it. So now when you see selected apply, you pick those that you're confident. Don't pick everything just because it's a select apply. You see, I intentionally said this that there will be one answer choice. And so be careful. Don't pick everything because it's a selected apply. There may just be one. And so there's 1 out of 5. If you pick anything more than that, you get wrong. Number 24. Which of the following present as a right to left shunt? So you have heart shunt, right? You have a right atrium, right ventricle, left atrium, left ventricle. So right to left shunt is those that go like that. And left to right is those that go like that. The right to left shunt are usually cyanotic. They look blue because the blood has not seen the lung. The left to right, they are not blue. They are acyanotic, but they have long conjection. So which one of this is right to left? Well, the best way to remember is those that causes blue, that means cyanotic, all have T at the beginning, except one. Okay, most of them have T at the beginning, and they causes the kid to be blue. They are the right to left shunt. Therefore, this is not right to left. This is not right to left. This is right. This territory of Foley is right to left. There's tracheous arteriosis, transposition of great vessels. They are all right to left because the lung is not matured and blood is not going to the atrium, left ventricle anymore. So what will happen is it shunt from the right side to the left side. And then you go to the systemic circulation. It has not gone to the lung, and kid is turning blue. So this is the right answer. So this is the end of the case. Down, adapt NCLEX. Check my YouTube channel, and you will never regret. So I encourage you to dig into those videos, sit down, all those questions, the content, and master them. And NCLEX, you can beat it anytime you want. Take care of yourself and never stop charging. All the best of luck. Bye-bye.